All right, thank you, Mr. Martino. Good afternoon, Chair Wheeler, members of the board. Brian Meisner, our Emergency Management Coordinator, also joined by Ms. Katie Kitts-Miller, our Deputy Coordinator. And we'll just wait for one moment for it to come up on screen. There we go. Alrighty, so the first thing I'd like to spend a couple moments going over is a brief overview of how a vaccine finds its way into the community. So as I think everybody's aware, the federal government contracted for the production of the vaccine, and they are in the process of making those allocations on a weekly basis as it comes off of the production line from the two vaccines that currently have an emergency use authorization, which is the Pfizer vaccine, the ultra-cold mRNA vaccine that's currently on an EUA, and then the Moderna vaccine, which is the regular frozen temperature mRNA vaccine on an emergency use authorization. The Commonwealth is notified what their allocation will be for a given week, and then the Commonwealth has an allocation process. Before I talk about that weekly ordering process, I do want to go over the two different columns here, the two different ways that vaccine is administered. On the left is the health district, and those are the larger clinics that you've been hearing about in the news and that we've been briefing you about that started at our CPAT facility for some of our healthcare workers and EMS providers, then moved to Metz Middle School last week, and as of this morning is operational at the Beacon Hall Conference Facility at George Mason University. So those are what are considered closed points of dispensing, meaning that you do need to have an appointment to come to those. Moving forward later in the presentation, I'm going to talk about the waitlist process, and that waitlist process is currently how you would obtain a vaccine through the health district side of this allocation in our community. The other side is with our private providers. So these are retail pharmacies, the Greater Prince William Health Center, which is our federally qualified health clinic in the community, the Mason and Partners Clinic from GMU, which serves the community over on the 28 corridor in Yorkshire and the surrounding community, our healthcare systems, Centera, Novant, Kaiser, and then other private providers do have the option to sign up directly with the state to be a recipient of this vaccine and assist in administering it, as long as they agree to abide by the state's priority process that's been outlined by the governor. Some of these providers will end up using the waitlist process that the health district has put in place. They want to make sure that they're helping add capacity to the community, and they recognize there's a list of folks who have gotten in line, and they want to help the health district with that throughput as the vaccine becomes available. Other providers will serve their existing clients within that state criteria. So an example would be the Greater Prince William Community Health Center and the Mason and Partners Clinic have clients that they serve with underlying health conditions or who work in some of the currently eligible fields, and so they are serving those patients as part of this process. The private providers have to communicate with our health district the number of doses they wish to request on allocation for an upcoming week. Our health district then in turn takes that request and sends it to the Commonwealth, and they make decisions about who's going to be allocated what amount of vaccine. The difference here is that for those private providers, they are getting that shipment directly from the Virginia Department of Health. Our health district has no role in it after they have communicated it up to the state, and the state has made a decision about allocations. And then for our health district, they also will get their own direct shipment from the Virginia Department of Health. So, as we have all seen in the media and as we've updated you over the weekend and throughout the last several weeks, the demand continues to exceed supply, and that's going to continue for some time. The Commonwealth's allocation was previously about 110,000 doses of vaccine per week. However, for the week of 118, the full allocation did not occur. Previously, the health district's requests were fully filled. However, for this current week, the week of the 18th, they received 1/5 of the amount of vaccine that they requested for the week. Some of those private providers in our community that I just read through received none of the vaccine that they had requested for this week. And there are other localities in Northern Virginia who received none of the vaccine they requested for this week. So we don't fully know why the allocation was reduced at the Commonwealth level, whether it was a reduction from the federal government, whether something else occurred, but the on-the-ground reality is there was a significantly lower allocation this week than the Commonwealth had previously experienced and from what the health district had requested and hoped to be able to provide. So as a result, additional appointment slots cannot be scheduled until the vaccine allocation and availability increases. In addition, the health district cannot accommodate requests for community-specific closed pods until there's much more vaccine available. The most important thing right now is making sure that there is equitable access to facilities throughout the community through that waitlist process that people are freely able to join. And I'll come to the waitlist process here momentarily. The one thing I do want to emphasize is that there is no walk-up option for any of these clinics at this point in time. There has been some differing information on that, but based on the overwhelming demand, there are currently about 25,000 people on the wait list in this health district. We need to be sure we're adhering to that wait list process, and so unfortunately there is no walk-up option for any of these clinics. There are procedures in place where if they're going to have doses left at the end of the day, they have access to that wait list process and or are able to go to any other eligible individual on the groups to make sure that a shot is going into an arm so that there is no waste. But they are asking that there be no walk-up access to the clinics at this time. So the wait list, as I mentioned, the health district reached out and asked for some assistance in getting the wait list process unified. So the new wait list is in operation. It went into operation over the weekend. A short link to get directly to that wait list is bit.ly/PWHD waitlist. That will take you to an interactive form process to work through. And if you meet the current criteria that I'll review in a moment, you'll be placed onto the wait list. We do know that there were a couple different processes in place over the last week or so, and the community still has a lot of questions about whether or not they're going to receive a confirmation or how do they know for sure that they're on the wait list. So the health district has also asked us for help with that process, and we do intend to help them send out notifications to everyone that signed up through one of the old forms prior to this Saturday the 16th at some point this week. So again, we're working towards that, and we will be able to come to a certain point in time where we can say we've made all attempts to notify out contact data before this past Saturday. And if for some reason you didn't receive a notification, then at that point you should go ahead and make sure you put yourself back on the list. So we are working towards that with them. The other important thing here is that we're still required to follow the state priority order. The thing that's about to come into play is second doses. So the health district got their first vaccine shipments and started clinics on December 28th. That means on January 25th, those folks are eligible for their second dose. Many of those were our EMS providers and some of the other healthcare providers in the community, and some of them have their appointments scheduled, but based on the vaccine allocation situation, that has to be factored into play, and it's going to impact the number of appointments that are available for folks who are looking for their first dose. So that is something the state's mandating, and the health district must follow it. Then the priority still will be those 1A healthcare workers who may have missed their first opportunity or decided to wait for whatever reason. If they sign up today, they have to be prioritized above anybody else in 1B or those additional groups of persons age 65 plus or those who are 16 to 64 with an underlying medical condition. One important note I do want to make on the eligibility for those age 16 to 64. Of the two vaccines available right now, Pfizer and Moderna, the Moderna vaccine has an emergency use authorization for 18 years of age and older, and that is currently the only vaccine the health district has access to. So while those folks are eligible to sign up on the wait list, they are not able to be accommodated with the Moderna vaccine if they are 16 or 17 years old with an underlying medical condition. The health district call center continues to be available, and they have asked for our assistance in scaling that up. So we have given that assistance. It will now be available 7 days a week from 9 a.m. until 4:30 p.m. And we're actively reassigning dozens of county staff to improve the wait times and the experience on that call center. So here's the graphic that Dr. Ansher shared with you last week, and that will continue to be updated as vaccine progresses through the health district. The major changes to highlight is that in addition to the 1B Group 1 workers, corrections and homeless shelter workers were also added. And then the change that the governor announced on Thursday, moving persons who were 65 or older and people 16 to 64 years with a high-risk medical condition from 1C over to 1B. So that is approximately half the Commonwealth's population that is now eligible under the definition of Phase 1B. I do want to take a quick note because we are seeing lots of questions about Phase 1B Group 3, child care workers and teachers. As far as we know, with the information we have, the process is still on track for those workers in our community to be accommodated by ANOVA. The health district continues to be in touch with ANOVA and with our school system, but has asked me to share the same concern of vaccine availability comes into play here. So the intent for service is still there, but if vaccine allocations are cut, that process is going to take longer. And because the dosage that came to the health district was also cut in a fifth, it just further constrains the ability where the health district might be able to work those folks in. And that arrangement they've made with ANOVA is still a very good arrangement. It just may take some extra time. So we'll learn in the coming days what that allocation situation looks like. The school systems will be reaching out directly to their employees, and it's our understanding that there will be some tiering within the school systems based on those folks who are at highest risk or who are currently in the classroom. So we do ask that if teachers and staff in our school systems have questions, that they reach out directly to their employer, and they are working through that process of communicating with their staffs and teachers. Private schools and child care facilities, the health district is asking that those facilities have a list assembled and ready to go of all their personnel with first name, last name, email, telephone, and whether or not that staff member is working in person or remotely. And they will be receiving some direct outreach from the health district about next steps for those private school facilities and child care facilities in the health district in the coming weeks. I want to go into a little more detail about the pre-planning that the county emergency operations team has done to support the health district. And again, the caveat here is all this support is dependent on vaccine availability, which is the current constraint. We have identified sites and have a list that's been pre-screened and vetted, in some cases with complete operation plans ready to go on the shelf, where we just fill in the blank on number of contacts, et cetera, for a given site. So we have looked at 5 different county facilities or park facilities, 15 school facilities or sports stadiums, 2 private or nonprofit facilities and their parking lots, 2 large rental opportunities in the retail sector, and we have also provided the state with a private sector partner who will be willing to host one of the state-supported mass COVID-19 vaccination sites that Governor Northam also talked about last Thursday. As a county, we are also actively providing some contract clinical support, non-clinical staff members, as well as site security for the Beacon Hall Clinic, and are prepared to provide that same support for additional clinics as vaccine availability allows. We are also working with several pharmacies at the request of the health district. These are retail pharmacy partners, typically in grocery stores, who have pharmacists who are available to vaccinate, but there's not enough space in their store because we still have to make sure we're adhering to social distancing and spacing, and there's still a wait time where somebody needs to sit after an appointment to make sure they don't have an adverse reaction, and there just isn't a lot of space in some of the grocery stores. So some of those pharmacies have approached the health district, and we are working with them to take a look at these list of identified sites and be able to open that as a closed pod site with those pharmacy personnel being the vaccinators at that site. That will still be an appointment process. The ones that are currently speaking with the health district have indicated they'd like to use the wait list. However, they will have their own scheduling systems. So I do just want to briefly touch on some data that we've been showing you here for the last several months. This is our current percent positivity rate and the number of our positive tests versus tests conducted. The current rate for the 7-day moving average is 15.9%, and the state's rate right now is 13.9%. The reason we want to highlight this chart, though, is I've noted on the chart where Thanksgiving is, with the increase in cases likely from family gatherings at Thanksgiving, then a plateau, then Christmas, and an increase of cases 7 to 10 days after Christmas. And then it looks like most everybody chose to stay home for New Year's, and there's been a decrease of cases. There is also, as I'll show on the next slide here, there was a change in the data reporting process from the state, so that is why there is this 1 day of spurious data here over the weekend. But this is the hospitalizations in Northern Virginia, and while there is a slight increasing trend, it is still steady, and the trend in other parts of the state is much higher than here in Northern Virginia. So there is still plenty of hospital capacity for folks who contract the virus and need hospital attention. And the reason I want to share those data points is because vaccine is just one part of the strategy at combating COVID-19. It's going to take months for everyone in the current priority groups to be able to get a dose at the current allocation. The community will not be able to realize open points of dispensing where someone can just hear on the news that we're doing 5,000 or 10,000 doses in a day and go without appointments until there are more vaccines on the market. is the unfortunate reality of the situation. So with that, the mitigation measures that we've been all hearing about and asking folks to adhere to for months now work. Wash your hands, wear a mask, watch your distance from others, avoid crowded places and large gatherings, and please try to telework when you are able. So in terms of next steps, I just want to reiterate that the Emergency Operations Center and team, we're in touch with the health district multiple times a day, 7 days a week. I was on the phone all weekend with them, working through some of the questions and concerns you all have raised from your constituents, and some of the process steps with the web form and the waitlist process to try to make it as seamless as possible for our community. We also talk with our peers in the two cities daily, both at the Emergency Operations Center level, and then our communications team for the county talks with their counterparts in the cities and the health district on a daily basis as well. And we're talking with the county school division staff multiple times a week. Vaccine supply continues to be the current constraint. Pre-planning efforts are still continuing. We're going to get to the point where we've got a plan on the shelf for every single one of those opportunities that we've lined up. But until the vaccine's there, we won't be able to take advantage of the vaccinators that we're preparing and all the different site support elements that are available. For the board members, we would ask that you please keep leveraging that government liaison officer process. It's been working very well. Just the one quick note is that for questions that you might have for the health district or Dr. Ansher, we'd ask that you please consider also sending those questions to the government liaison officer so that we can give one aggregated list and try to get one list of questions a day answered, similar to that the list of answers you all got back last evening. I think that would be most helpful to help the health district focus their efforts with the various clinical and state calls that they're on throughout the day as they try to help increase capacity for us. Certainly you're able to reach out, but we would ask that you consider using that government liaison officer process for questions for Dr. Ansher and her team as well. We ask our county colleagues, our employees in the county, to please ask their supervisor if they have any questions. Mr. Martino's sent information to the leadership team about how the EOC will be helping answer those questions and prioritize those folks. And we are still coordinating with our departments so that once the health district tells us they are ready to move on to additional priority groups in 1B and 1C, we have that information already to go to send over to them and get those folks lined up for their appointments. And with that, I'd be happy to answer any questions.
Thank you. I got a couple, but why don't we Supervisor Franklin and then Supervisor Angry, and then I'll jump in.
Sure. Just for clarity in terms of the number of vaccines that are coming into the county, have you all spoken to the state to figure out kind of what the issue is? And then do you have a good sense of what the forecast will be for getting more vaccines? And as you mentioned, it may not be a state issue. It may be the feds, but I'm just curious as to if there's any clarity in terms of what the actual issue is with capacity.
Our understanding from talking with the health district is that this week's lack of allocation was from the federal government. And they are hopeful that the Commonwealth will be back closer to the full 110,000 doses for the upcoming week. It is tough to say from week to week what they might have an allocation on. Some of the more rural health districts sometimes order in batches, and because of the rural nature of their clinics, they don't necessarily have clinics every day. And so, you might have 5 health districts that only order every 3 weeks, whereas the larger districts in the more urban areas would prefer to get their maximum amount every single time they can. So they are hopeful that there will be an opportunity for an increased number of doses in the coming week, but it is all dependent on what comes down the chain from the federal government and the allocation decisions that are being made in Richmond.
And when we get the expected amount, will that help with the wait list?
It will, in terms of we have enough clinical capacity and sites ready to go in the hopper, so that as long as the health district is definitively given a number, it's usually on a Friday afternoon. We can then immediately go to that process and look at trying to add some additional clinics the following Tuesday through Friday time period. It's tough to do a quick turn Monday for some of that, but the capacity is there where, say they're told that they're going to get, an extra 1,000 doses beyond what they planned. We have those plans on the shelf to assist them with. They'll tell us which one they want. It could also be a site in either of the 2 cities to make sure it's equitable throughout the district, and then the wait list will be released to those number of doses that are available. There's also going to be a function in the call center that helps reach out and contact people, particularly those that don't have an email address, so that if they do come to their point on the wait list and there's no email, they'll be able to get a call from a live operator to try to help get them scheduled.
And then lastly, can you just clarify the capacity issue as it relates to the second dosage?
Sure. So the second dose has to be allocated before additional appointments can be offered for people on their first dose. So for the clinics that are scheduled by the health district next week, some of those are some of the public safety and healthcare personnel that are ready for their second dose. And those folks, for the most part, are scheduled for appointments. We know there are some that were not able to get appointments, and we're working with the health district to understand those needs. And that's the kind of prioritization of if somebody has their first shot and they haven't been able to get booked for their second shot, that person has the highest priority. Even though we're seeing in the international media there are some countries that are switching to all shots at once model, the FDA has not signed off on that here. And so the risk of not doing second shots first might mean that the first dose ends up being not effective at all, and then you've essentially wasted a shot. So that's why the Commonwealth's saying you must do second shots first to make sure that you're following the emergency use authorization and maximizing the immunity that person receives from the vaccine doses.
So we have enough vaccines to do the second dosage, which means everyone who received the first dose will get their second dosage.
The federal government was to be holding back second doses and releasing those based on the 3 to 4 week lag time from when first doses were shipped. There's still some uncertainty as to what that process looks like. I don't even think the state can speak to that at this point. You're seeing some of the same comments in media. The clinics that the health district currently has scheduled, they have enough vaccine for. Some of those clinics are both first and second doses, depending on if someone was able to get their first about a month ago. If the supply does not increase come the end of the month, early February, then it might be a different conversation about first doses are having to be canceled and second doses, might not also be available. But we're hopeful it's not going to be like that.
Supervisor Angry?
Thank you, Madam Chair. Hey, Brian, let me just go on record and say, man, you were really good at this. Like, we just got here, and you are very thorough with a lot of information, and you've really dug in. I really like that. You got a lot of information there. Just really quick, and I'm going to make a statement first. So although we're in this vaccination period, and people are starting to, get a trickle of a light at the end of the rainbow, I still say our ship is taking on water, right? Because the COVID-19 virus is still very alive and active. And I believe the number, last time I said to Dr. Ash, was 1 in every 5 Americans are finding themselves, I hate that word, infected, or testing positive every day. And that's very concerning. We see those numbers go up. So I just want to go to the point of what you mentioned about washing your hands, social distancing, wearing a face mask. Like, I'm going to be, I know I'm muffled, but I'm going to be in this until we in a better place. And my question for you really is, churches have helped us a lot with the testing, right? We're using the technical side. Do you foresee in a future model of this, as we start getting more vaccine in, that we could probably, I saw some states doing drive-up vaccines. I don't think we're doing that. I think that's kind of wild because I know you got to watch the person. So I don't really know how that's working. So I don't know if you guys have thought about that. Is that a...
Yes, sir. So a couple answers to your questions there. First, on the drive-up piece, we are prepared to do that, but there is concern because of the very small number of anaphylactic reactions that we have seen across the country, where the health director and the folks who are administering these clinics feel most comfortable having those folks indoors in a controlled setting, where if they do have a medical emergency, they can immediately receive care. But we are prepared to do 6 lanes on 48 hours notice. If there's another vaccine candidate that comes and there's no concern of anaphylaxis, some of the shots that are in the process right now are single dose and can be stored in the refrigerator instead of in freezers. So there is some hope that once we get to that phase of additional candidates, that one of those would be a really good fit for drive-throughs, and that helps a lot with the throughput. To your other question about our faith partners, they are in the same category of, we know there's interest from some of our HOAs and retired communities because of the limited number of doses right now. The best and most equitable thing for the health district to do is to have as large of a site as possible based on the amount of vaccine they have. But it is the hope that there'll be opportunities for more outreach. Realistically, that is probably months away until we're at that kind of neighborhood level. Hey, if you haven't gotten your shot yet and you have trouble getting out or feel more comfortable doing it in your neighborhood, come here on this date and time. It's still probably months away.
Okay. And then just lastly, Madam Chair, I've been getting a lot of inquiries from our clergy, our pastors, asking about them being somewhere on the list because they're out in the streets and they're really doing a lot of the prayer services. So I don't know if that's a question for you or the board or for Richmond as far as the 1A, 1B, 1C, because they're nowhere on this. I don't know if that's an urgent issue or something we could look into, but, so I don't know. I just bring that to the attention because I told some of the pastors I mentioned that here.
Yeah, thanks for the question, Supervisor Inger. We'll take note of it and talk with our health district colleagues, and if they don't have the answer, we'll try to also get it from Richmond Point.
Thank you, Brian.
Thanks, sir.
Supervisor Cannon?
Madam Chair, thank you. Just a couple questions here. One, Dr. Ansher last week talked less about the need of more vaccines and more about not having enough qualified personnel on the ground to administer. I guess that word has gotten out to folks. So my office has received a good amount of nurses, both active and retired, doctors, both active and retired, who are willing to volunteer to come and take a day or two to be trained. So are we looking to reach out to the community to see if there's folks, or are we now backing away from the idea that we don't have enough personnel? It's now a supply. I just don't want to get into a situation where I hear we don't have enough personnel when we've got a whole community who seem to be willing to volunteer. We don't have to pay them anything to volunteer to help out with the distribution.
Sure, yeah, thanks for the question, Supervisor Canlon. So absolutely, and I also want to amplify the Medical Reserve Corps, which is part of a national program organized at the state level, and then there's an operational chapter here in the health district, has done the vast majority of these vaccinations for the health district thus far. So we really appreciate all the volunteer help that our medical providers, both active and retired, are doing. If anyone is interested in volunteering in that role, they should go to the health district's website, vdh.virginia.gov/Prince-William, and click on the MRC link for information about how to sign up to be an MRC volunteer. They will also take folks who are not necessarily clinically licensed too. So if you just want to help with an administrative role, we've had some MRC volunteers helping out in the call center. So there is absolutely still a need because, if all of a sudden we find ourselves with 5 vaccines on the market and we can do the drive-through sites and, anyone that wants it can get a community site on 2 days' notice, then that's going to take a lot more people. But for the current amount of vaccine that's available, there is no immediate concern for vaccinators. And we have also worked with the health district and have a contract nursing firm ready to go at a moment's notice for up to 30 folks. So that's not the current constraint.
Madam Chair, if you could send us all that link, I couldn't quite get all of that down. That would be great. So, and I know the folks are frustrated that they're not getting the vaccine, even though when you look at the grand scheme of things, the fact that we've turned this around in less than a year and we're getting vaccine out, I think is very impressive and shows a lot of good things with our government and our country and the private sector, but there's still frustration. People want to get back to a sense of normalcy. People are worried because we've got a lot of folks who are in that age range or with pre-existing health conditions. But one of their big concerns is just getting some sort of idea of when. And we talk a lot about, well, we were planning for this. We weren't getting what we were planning. I see this list of all sorts of different groups. If you go back a slide, several of them are in progress, but other ones are in 1B. Can we give folks any sort of direction? And I know hopefully that we can bring in all those dates, but if I'm a grocery store worker and I'm not on that list and we need to go through 2 rounds, are we talking February? Are we talking April? I mean, listening to Dr. Ansher last week, I was thinking on driving home, we're going to be into this summer before a good amount of folks are able to get that first dose. And I don't want to put any words in your mouth, and I don't want you to speculate too much, but I'm hoping there's some direction that we can give folks that this isn't going to be next week I'm going to be able to sign up because I'm a mail carrier. Can you give any more background on that, on what people should expect, on how long this is going to take? Because again, I even see teachers on there. They're not part of that in progress group. We need to get all those in progress people back for their second dose. And there's a lot of talk on social media about let's get all the teachers vaccinated right away. Can you give us a little bit more direction on that?
Sure. So I'm not going to be able to give a specific time. The 3 things I will say is that for folks who feel like they've already signed up for the wait list, We are working as hard as we can with our IT team at the request of the health district to get all that data cleaned up, aggregated, and to be at least able to acknowledge, yes, you're on the wait list. That's still going to take a couple days this week, so I don't want to give folks the impression they can call the call center right now and they can tell them exactly what number they are online, but we're working towards that. So they at least know where they're at in line. And hopefully as we start seeing more vaccine come, there'll be some more reporting about how many doses we're doing, and people will get a general idea of how much vaccine is going out into the community on a weekly basis. The second thing is that, again, I'll caution that approximately half the Commonwealth's population are now in these eligibility groups. And my understanding is that the Department of Health has told the health districts that they are required to equally weigh the needs of those age 65 and older and 16 through 64 with pre-existing medical conditions because of the data that shows they are at a higher risk of more severe injury or death if they contract COVID, with the folks in those 1A and 1B not 1A, but in 1B priority groups. And that was also done partially at the suggestion of the federal government, at the CDC. So it is a very difficult situation to help manage expectations, and there's a very large number of people who are currently in this pool of eligibility. And as you alluded, until we have some additional vaccine available, it is going to take some time.
Supervisor Bailey.
Thank you, Madam Chair. Brian, thank you so much for this quick update. It's very important. I wanted to ask 3 questions. One is, with this update, is there a concise version that we can share with our constituency, or is this the version we can, or is there something that I may have missed that you've sent out already?
Sure. I mean, everything here certainly is able to be shared. We'd be happy to work with our communications team to get a shortened update that's more palatable and high level for your constituents.
Yeah, because I think it'll just kind of ease the pain of not understanding what's going on.
Okay, we'll have to put that together.
Thank you, Brian. And then the second thing is, I know that you are working regionally as well. You mentioned about the 2 cities, but I know you're working regionally as well. Can you kind of share that with us in terms of how that partnership is going, and if you can give us a level of expectation for that as well?
Sure. So I guess I can say that we're in touch with our peers from the other jurisdictions on the emergency management side. In terms of how vaccination efforts are going, those occur at the health district level. So each of those jurisdictions has a health district as well, and they are making their own allocation requests and their own decisions about volume and throughput. In speaking with peers, everybody's having the same challenges right now of there's lots of interest, lots of demand. Been some challenges with how you aggregate the data and get folks on a list, and everyone wishes there was more. So we are seeing similar concerns from our peers throughout the region.
And the reason why I say that, not to say that you're not partnering, but I've heard also from some of my constituents that Fairfax is getting more attention than some other regions. So that's why I'm just putting it out there in terms of just a level of understanding for the community.
Sure. I guess the only thing I would offer for that is, the Fairfax Health Department is making decisions about what they were comfortable with allocations, but a large part of the Fairfax community is also because of the Inova Health System, which is one of the largest health systems in the country. The difference there is that there's the 2 vaccines, the Pfizer Ultra Cold and the Moderna regular frozen, and the healthcare systems. There's, I believe, 23 healthcare systems throughout the state that are being given the Pfizer vaccine. And then the health districts at the community level are getting Moderna. So because there's 2 different channels, some of that unfortunately just may be that there was a lot more Pfizer vaccine available than Moderna. And because that health system is tied in with that community, they have been able to do a lot more outreach. And they've also been able to do outreach for us, for our school teachers, which is a good blessing in disguise there. So
yeah, that's what I need you to say. So, and then the last question is there a once the first group, the 1A group, gets the shot for whatever allocation that we have, are they provided like a chit or something with the next time that they need to come in for the second shot?
Yes, ma'am. So there's a standard CDC card that is part of the fulfillment process. So the 2 vaccine manufacturers ship the vaccine directly, and then there are other contract outfits that are shipping all of the ancillary supplies to the recipients, so the syringes, Band-Aids, et cetera, alcohol pads, and there's a card as part of that. So you are given a card with the date of your first dose, the lot number, the manufacturer, and then you turn the card over and it tells you schedule your next dose after this date.
And then lastly, Madam Chair, thank you for that as well. You've been masterful in the allocation for testing. I mean, there were some growing pains in the beginning, but you've been masterful in making sure that that's being done. And you just mentioned that once we get the okay, and I'm very hopeful that that will be soon. It might be the summertime, like Supervisor was saying. Will there be, in the same spot where you're doing that testing, is it a potential, seeing that there's no risk, potential that you can also give the shots there as well?
Yes, ma'am. And those are again, I don't want to speak for the health district, but those are the types of community-based events that they are contemplating. But
Okay.
again, we would need to see a lot more vaccine many months away.
Coming
something
to.
like that's available.
Okay. Thank you so much.
Yes, ma'am.
And I know Supervisor Bodie has a question, and I'll go to Supervisor Bodie and then Supervisor Lawson.
Sure. Thank you so much, Madam Chair. Brian, thank you so much, as always, for your great presentations and your timely updates. I have a couple of questions that are sort of harder questions. I hope you can answer them for us. First is, you talked about it earlier, but there's a lot of different sign-up sheets and forms going around. You know, there's a Google form, there's a VAMS form, and there's a form that shifted from 75 and over to 65 and over. So there's frankly a lot of confusion in terms of what form do people fill out, and if they filled out an older form that's no longer being circulated, will their information still be fed to the system so they can get in line? So that's the first question I have is, all those older forms that people were filling out, will those be still monitored and will they still feed the system? So if someone has an older form, they're not sort of lost in the shuffle.
Yeah, thanks for that question, Supervisor Bodie. So there's two parts to my answer. I want to address the local part first. So anyone who signed up on the health district's Google form, and I do also want to take a moment to say it is a legitimate Google form. The Commonwealth uses the Google suite of applications, including email. And if you scroll to the very bottom of that form, it said this form was created inside Commonwealth of Virginia. So I know we had some security concerns. We got some cyber-minded residents that had questions and concerns. So that was a legitimate form. They have provided all that data to our IT team, and that our IT team is aggregating that into the one master data source. So none of that data was lost. And that's the process I talked about, where we are working to give all those folks a notification, so they at least know, you submitted and you're on the list, and you don't need to resubmit to be on the list. All of the places where existing forms were up, and there were only two. One was for healthcare providers all the way back in December, and that was communicated only to the healthcare provider community because it was a closed pod for 1A. That form now feeds to the new unified process, and the Google sheet also now feed to the unified process. So all the questions have been taken off of those, and there's a link saying this form's no longer in use. Click here, and it takes you to the form you're supposed to be using. So we're not turning any links off. If anything's floating out there in the media or on websites or newsletters, it's going to get you to the right place. And the new form, the direct link to it, is bit.ly/PWHD waitlist is the new version of the form. I do want to take a moment to address some questions we have seen at the VDH headquarters level, the main VDH website. There is a tool on there that is phrased, bear with me for one moment. Find out which phase you are eligible for. It's on the vaccine dashboard on the VDH site. We have worked with our partners at the health district, and unfortunately they have not been given an answer as to where that data goes. And we do not recommend that anyone use that form, and use of that form does not constitute signing up on the health district's wait list. If and when the health district receive access to that data, they will be sure to communicate with everybody on it that they need to, depending on what can be done with the data, they will either A, say it's been able to be added to the master wait list, or B, tell them, I'm sorry, the data wasn't usable, you need to go ahead and register on our wait list instead.
Sure. Oh, thank you for that, Brian. So a couple more questions. You referenced it earlier whereby you guys are aggregating all the data that you've received thus far and are going to put it into a clean format so folks can see where they sit in the list. My follow-up question to that is, on a macro level, will there be a point at some point where you can provide us as elected leaders some macro information? I know you spoke to Supervisor Bailey a little bit about before, where we can see how many folks are in, phase 1A, and 1B, and how many folks are on shot 1 of 2 and 1A and of 2B and what have you. So we can start to get a handle, as elected leaders on where we are in the process. And frankly, so the public can see just the sheer amount of people are in each bucket, so they know that this isn't a small undertaking, that we have a lot of people that have a lot of steps they need to take to go from, okay, I've signed up, I got my first appointment, now I got my first shot, now I got my second appointment, now I got my second shot, and whatever steps may follow after that. Is there a way at some point for us to get that information as well?
So we will take those questions back to the Health District Supervisor Bodie. I do want to caution that they are still required to use some of the state reporting processes. Any amount of information that can be shared will be very high level, and there are HIPAA privacy considerations. And even though we are assisting them, they are still the owners of the data. So ultimately, it's them to make a determination on what can be released. And I will also just try to set the expectation that folks will not be able to go on some website to see if they're on a list. There's going to be a notification out, whether that's an email or a phone call based on how they registered in which version of a list. And then after we send all of those, we will be sure to work with the health district and our partners in the other jurisdictions to get the word out that all confirmations have been sent. And if you haven't heard anything, you should call into the call center to ask if you're on the list or not, and they can securely verify that person's identity and give them a yes or no. So it's not going to be a publicly searchable thing for privacy reasons.
Sure. Thank you for that. My final question, I have to bring it up because folks bring it up every time. We have a lot of teachers and school-based employees that are already in buildings that frankly have been continuing to reach out to us and really express their concerns about the fact that it seems like every time we start to have these conversations about where we are with the vaccine, there's always a reason why, our supply got chopped down to a fifth, like you said, or we got something late. And it's frankly getting to the point that a lot of people are really, really, really concerned that for some reason we are being not left out, but we're being an afterthought into all these other different jurisdictions, other folks, and other communities, where we frankly have the second largest locality in Virginia, and we have some of the highest positivity rates, and we have the most people in schools. And it's getting to the point that folks they're not sure what their future looks like because they're afraid they go into a building, they get quarantined for 14 days, they don't know what they're going back into, and we're still under this pressure, at least on the school side, where kids more and more kids going back over the next 2 to 3 to 4 months. Is there anything at all that we can do from the county side to better part of the school system and to know to make sure that at least on their end they're more reliable? Is there anything we can do to advocate to the state or even to the new administration that's taking their seats literally tomorrow to make sure that one, we make sure that our teachers and the school-based employees get vaccinated as soon as possible. Two, more importantly, that they make up for the lost dosages and, frankly, a lot of the delays that we've already experienced, because we're not only behind now, we're also missing out on a lot that we were promised before. And who's making sure that we're made whole in all of that?
So thank you, Supervisor Bodie. I certainly understand the concern and feel the frustration that a lot of the educators in the community are experiencing. What I can tell you is that our partners at the Health District are working tirelessly, as hard as they can, to come up with as many opportunities as they can for vaccine clinics and continue to advocate for the state to make sure we're getting as many doses as we can. And the 3 jurisdictions are right there with them, supporting every ask that they may have to take that off their plate so they can keep focusing on that all-important priority of scaling up. But unfortunately, at the end of the day, it does come down to allocation decisions are made by the federal government and by the Commonwealth, and there is only so much that can be done within the confines of that allocation and the priority list that the state has mandated. And we are very fortunate that Inova is partnering with our school division as well as the cities to do what they can to help make sure that vaccine finds its way to that population and priority group.
Thank you for that, Mr. Meisner. Thank you, Madam Chair.
Thank you, Supervisor Bodie. Supervisor Lawson, I think, right?
Yes.
Okay.
Well, sure, I'll go.
And then Supervisor Vega, and then I'll just finish us up.
In all fairness, I think she was ahead of me.
Was she? Oh, was she? Okay.
She was.
Supervisor Vega, and then Supervisor Lawson. And then I'll go.
Thanks, Madam Chair. Brian, I want to go back a little. In terms of the allocation reduction, you stated that you didn't know why. Did we inquire as to why we experienced a reduction?
We did, and they've not received a response that gives any additional information.
Okay, and you may have stated this, and I might have missed it. Is this something that just happened to Prince William County, or are neighbors experiencing the same thing?
No, others are experiencing the same thing. So of the private providers, some of the private providers that gave the health district a request for 100 doses, 200 doses, got nothing this week. And then other jurisdictions in Northern Virginia, their health districts made a request and got nothing or next to nothing.
Okay, and then the final question that I have is, we're still getting a lot of folks who don't have access to internet or who don't have an email, and they have to call it in, and they're stating that they're sometimes on hold for several hours. Could you elaborate a little on, maybe this is going to change or what folks can expect moving forward?
Sure. Thanks for the question, Supervisor Vega. So we are aware, and that's why the health district reached out and asked for some assistance. We actually lended some of our infrastructure all the way back in May, and so the health district call center has been on that since that time. It is in the cloud. It is scalable. We've been working with Mr. Martino and his leadership team to actively reassign dozens of county staff to get more operators in that call center. There were some extremely long waits last week. There was a little bit of a wait, perhaps up to 2 hours first thing this morning. When I looked at the metrics before walking over, we were down to about a half hour, and there was twice the number of agents logged in that I saw when it first opened at 9 a.m. So we understand that we know folks are frustrated. We do ask that if you have access to the internet, or even if you have a friend or family member or neighbor who can fill that form out for you, it's the exact same form. So please don't call just trying to see if you can get on the form a different way, because the operators who are assisting folks register who don't have access to the internet, all they're doing is pulling up the exact same public version of the form and typing it on and walking through the caller with the question and answer process to determine if they're eligible.
Okay, and finally, Brian, I just want to thank you, Nikki, and the rest of the team for literally working around the clock. I want folks in Prince William County to know how amazing these folks have been in getting our questions answered so that we can then provide responses to our constituents in a timely manner. So thank you very much. It's greatly appreciated. Thank you, Madam Chair.
Thank you, Supervisor Vega. Supervisor Lawson.
Thank you, Madam Chair. And Mr. Meisner, thank you for being here again, and thank you for all your hard work and efforts that you've poured into the county, especially in the last 9 months. Couple questions for you. I have a principal who has shared with me the willingness to offer their school for a vaccination site. How do I advocate for that site?
So we've actually received several other requests from other principals, and the health district has directly. We are coordinating directly with several of the associate superintendents regarding facility availability. There are some considerations that they are having to weigh because we do have pupils in the buildings, and some of the facilities have sports ongoing. So they have worked with us, and they have given us, again, a list of 15 sites that are eligible candidates, both in terms of indoor space, where the student census is practically nothing because of the groups that are currently in, as well as some stadium space, whether it's for walkthrough or drive-up space at some of the stadiums. And we will continue to reevaluate that facility list with them on a weekly basis. They've also made space available in their administrative facility, and my understanding is the health district's going to be using that for some training for MRC volunteers and others as they come on board to make sure we've got that really high pool of.
So the school division's very actively involved in the site locations?
Yes, ma'am. We speak with them. Ms. Cassiato from executive management and the EOC team speaks with them multiple times.
Good to know. Okay, thank you. And then just for clarification, if it were not for Inova Health System, our Prince William County teachers right now would not be in the queue for vaccinations, because according to your list, they're not yet eligible on this 1B. So if it weren't for Inova, we'd really be looking at an unknown date for teacher vaccinations?
We'll take the direct question back to the health district and give you the response. But essentially, if they were as a district, because the governor did make known that it's now a decision that lies at the health district level with the health director as to when each district moves within the phasing in each phase. So if they were to just go ahead and open it up to 1B3 right now, those folks would be at the bottom of the 25,000 people that are already on the wait list. And because there is clinical capacity that Inova might be able to offer, we're trying to tier it and time it where based on when Inova has told them that capacity becomes available, there's hopefully a match there between where folks fall in line.
Okay. So not real clear what that answer was, but the reason I'm asking is because I think it would be nice if our board could maybe write a letter of gratitude to Inova. Maybe that's something the chair is already considering, or?
Well, when you're done, I'll talk about
Okay.
the Inova.
Okay. Because, wow, I mean, what a huge help to us. And then the last question I have for you, Brian, we receive emails of a lot of frustration from county residents about the vaccination rollout. I've seen charts on Facebook that I don't know if they're credible or not, that Virginia's like 47th, 48th in the rollout. Can you tell us if you know if that is indeed true, that we are struggling, we have more challenges for whatever reason? Are these legitimate rankings? And secondly, what can we do to help other than, I mean, we can only do so much, especially when you're talking about the federal government,
Yeah.
but what can we do to help roll this vaccination out faster?
So for your first question, I can't speak to the exact charts and articles. I do know the Health District has shared with us that there have been some reporting delays into the Virginia Immunization Information System, which is how they develop their metric and dashboard that gets shared up with the federal government. So they are actively communicating with their health district to try to make sure that the data is getting in there quickly and that there aren't delays. But I can't comment on the specific rankings. And in terms of the process of what the board could do to help, you all have been wonderful in helping get the word out to your constituents and also bringing us questions and rumors when they're there so we can get them clarified and try to make sure everybody has the most accurate information. But as you alluded, it really continues to be a supply issue at this point.
Right. All right. Thank you.
Thank you. I'll end us up with thank you very much, Mr. Meisner. You guys, I mean, you've sort of pivoted, and I know it took us a while to get in the. Did you go? Okay, sorry. Get in the swing of things, and I know that you've been offering help to our health department, and it's great to see that they're taking that, and we're moving along. I do want to say I spoke to all the three health providers last Friday or Thursday directly about the systems, and it is a shortage issue, and I know that with regard to our teachers, Inova is set to vaccinate our teachers, and I think Dr. Ansher mentioned this last time she was here. They can start signing up on the 28th and start getting vaccinated the 30th. Just an expectation management. If I know that Inova did not get their full allotment of vaccines. And so it's it literally at this point. And so I know that I'm sure that Dr. Ansher, once she knew that they were set, for Inova, knew that they were taken care of. I think it's important to realize that if Inova doesn't have those vaccines, our teachers. So if you want to advocate for Inova getting vaccines from the state, I will go ahead and do that publicly to get our teachers vaccinated. And I do want to thank all three of our large health systems in the county, because Inova does have facilities in our county. Yes. For the work they're doing and reaching out and doing the job, even to just do their own health workers, which is so important. I do have a couple of questions in regards to the total number. Do we know the total number who have been vaccinated in Prince William County, either by the health department or total to date, or how many or better yet, how many doses we've received? Is that a number that we know?
We'll get the firm numbers and get back to you.
Okay.
The number vaccinated in the county, and I do want to offer this caution so everybody's aware. The one VDH dashboard that shows vaccination by county right now is based on the residence of the person who received the vaccine. Okay. So if we have a firefighter who was vaccinated at our clinic and lives in Culpeper, they're going to show up on the Culpeper map.
Okay.
And so for our health workers that live in the county and might work in Fairfax, Arlington, Loudoun, and were vaccinated by a health system, they're going to show up on our map. So there is a little bit of data sorting there to get you an accurate number.
My next question is just assisted living facilities. We haven't really talked very much about that because that's the federal government going in and doing those, right, through different providers. If I have a facility that I know hasn't been scheduled yet and isn't scheduled for a couple of weeks, who would I talk to? Like, who's sort of overseeing that?
Sure. If you wouldn't mind, if you could send that to the government liaison officer process, because we've got an issue tracking log.
Okay.
We do know from the health district that they are They've received some communications from the state level about how that process is working. As you alluded, the federal government did contract with Walgreens and CVS to do the long-term care facilities and then the assisted living facilities, and not all the long-term care facilities are done yet. So that might be why those ALFs have not received word. But we will certainly ask the health district for additional information. I believe there's a coordination call scheduled.
Because I know the congregate care places were really some of the things that were targeted because that's where it can spread so rapidly.
Yes, ma'am. They were, but they were tiered. So doses fully. We'll talk about that in a minute. But they were tiered within 1A. So even though on the graph we show it everything in 1A, it was long-term care facilities with skilled nursing, then assisted living, then group homes within that tiering. So there's still a process there, and unfortunately, they haven't finished all those skilled nursing facilities yet.
Okay.
So, and thanks, Katie. So based on the VDH map, which again is by location of residence, 12,071 doses administered, and that was the total number of doses. Of that, people who have received both of their doses is 1,404.
Okay.
Based on residence.
My last question, if you could just sort of talk to, I know that there have been a talk about school nurses. Let's use our school nurses, and I know that there's a process for them, and I know that we're looking at that, and I'd like you to speak to that just a little bit to say, yes, we know that they're available. Yes, they need training, I believe. Is that correct? Medical Reserve Corps. Just sort of speak to that and say we're aware of that and already utilizing that, if you could.
Yes, absolutely. So many of our school nurses are those wonderful MRC volunteers that continue to support when they can after hours and on the weekends. They were the folks who, during the winter break, did our initial EMS providers and healthcare workers. We are in conversation with the schools about ways that additional school nurses would be available to keep supplementing that resource for Dr. Ansher. And those conversations are ongoing, but we're still at that supply constraint phase where they have enough vaccinators for the number of appointments that currently matches the vaccine they have on hand.
And are we working on training more people if we need to? I know they have to go through training for doing some of this.
Yes, ma'am. So they are, the health district is looking at increasing the number of training opportunities so that as new MRC volunteers or contract support staff become available, that everyone is checked off and ready to go just as soon as the vaccine is available.
Okay, great. Thank you. At this point, I think it's clear that if we don't have vaccines, we can't vaccinate people.
Unfortunately.
It's a problem nationwide, I'm sure. Thank you so much. Thank you for coming. I assume there are no further questions. Really appreciate all the work that you do.